to the videos what I have been taking up in pharmacology. Today's video I'll be mainly discussing upon the anthelmintic drugs of the pharmacology. So this was a very important classification, and you are when you are supposed to write in the professional exams. So in the professional exams, they very frequently ask you about the anthelmintic drugs, and so in this video we'll be looking at as to what are the anthelmintic drugs, what are the incidents of it, how these drugs, what is the mechanism of action of these drugs. So in this video we'll be mainly focusing upon all these aspects. So viewers, starting with anthelmintic drugs. So these anthelmintic drugs are those drugs what are basically given for hookworm infestations, and whenever there is any kind of an infestation of certain parasites in the body, so these anthelmintic drugs are being given. So basically these anthelmintic drugs, these is importantly, most commonly they are given for hookworm infections, and particularly these hookworm infections, they are most commonly seen in the developing countries. So it is mostly seen in those people who are having poor hygiene, and the most important parasites what get infested, that is the Ancylostoma duodenale and the Necator americanus. These are the most common hookworm that infest the human body. So these are the two important hookworm, the most common hookworms that infest the body. It is the Ancylostoma duodenale and Necator americanus. So when we look at these anthelmintic drugs, these are the deworming agents, means they help to get rid of the worms out of the body. So there in this anthelmintic drugs, there are particularly two things what we need to study. First is the vermicide. This vermicide is going to kill the worms, but something what is called as the vermifuge. So it promotes the expulsion of the worm. All right, so killing of the worms, it is the phenomena, it is called as the vermicide, and vermifuge, it promotes the expulsion of the worms. So in the anthelmintic drugs, basically there are two important drugs. First is called as the mebendazole, and next it is called as the albendazole. So in mebendazole, it is basically a chemical what is the benzimidazole group. It is derived from this group of chemical compounds, and it was first introduced in the year 1972. So it is a broad spectrum antibiotic, it is a broad spectrum anthelmintic, and it cures the roundworms and the pinworms. So basically when we look at the mechanism of action of this mebendazole, so it actually interferes, it blocks the glucose uptake in the parasite. So this glucose is very important for the normal metabolism, for the normal functioning of the parasites. So once the parasite is unable to get the ample amount of glucose for its functioning, for its growth, for its reproduction, for its survival, so this mebendazole, it blocks the glucose uptake in the parasite, and it causes depletion of the glucose stores. So whatever the glucose stores these parasites are having, it is going to deplete these glucose stores, and ultimately that will cause the eggs and the larvae are destroyed. So this mebendazole, this mechanism of action is there. And when we look at the site of action, so these parasites, they have in their cytoskeleton the certain kind of a microtubular protein which is called as the beta tubulin. So this beta tubulin protein of the parasite is there, and which is very important for the process of structural strength of these parasites. Apart from this protein of beta tubulin protein, the microtubules, they help in the process of cell division. It has so many various functions. So the structural strength to the parasite, it is being given by this microtubular beta tubulin protein, and mebendazole is going to bind to this beta tubulin protein of the susceptible worms, which high affinity, and ultimately they are going to inhibit the polymerization. So once they are going to inhibit the polymerization of such protein, so the structural strength of these parasite is lost, and that too the division of these parasites in the body is inhibited, it is stopped. So The ultimately the hatching of the nematode eggs and their larvae is also inhibited. So once this protein is being inhibited, so neither the parasites what is being multiplying in the body, neither their eggs are going to hatch nor their larvae are going to survive. So both they are inhibited, and Ascaris ova they are also killed. So whatever the ova are present, they are also killed. So this was in a very short, that is the mechanism of action or the site of action where this mebendazole is acting. So when we look at the dosage, in what dosage this is given, so it is very important that the dosage is 100 milligram twice a day for 3 days. This mebendazole is being given to the patients who are having this hookworm, pinworm infestations. And when we look at the side effects, so this mebendazole, that is the anti-helminthic drug, so this mebendazole, it is given in large doses, and when we look at the side effects, it may cause little bit of headache, dizziness and loss of hair. So thus such side effects can be seen on administration of the mebendazole. Apart from this, when we look at the uses, so apart from this, this mebendazole may rarely cause an abnormal migration of the roundworms. So this mebendazole is having another side effect, that they may cause the abnormal migration of this roundworms, and that too this abnormal migration of the roundworms, it is seen rarely. What will happen, that this the side effects, that is this mebendazole is going to cause, may rarely cause the abnormal migration of the roundworms, and they may come out through the mouth or nose. So do remember, this is very, very important, that one of the side effects of mebendazole is that it may cause the worms to come out, to be expelled through the mouth or through the nose. So in very rarely it has been seen, but still it has been found in certain cases. So may rarely cause the abnormal migration of the roundworms, and they may come out through mouth or nose. And when we look at the uses of this anti-helminthic drug, that is the mebendazole, this mebendazole is given in uses, it is used for multiple worm infestations. So multiple worms such as pinworm, tapeworm, see all such hookworms, roundworms, in all such infestations, this mebendazole is given. The next important drug, what is the anti-helminthic drug, which is very, very similar to this mebendazole, it is called as the albendazole. So this albendazole, it is a congener of mebendazole, and it is having similar action. It is having somewhat similar action, but it is better tolerated. So when we look at the tolerance between the mebendazole and the albendazole, we find that this albendazole, it is better tolerated, and the advantage of albendazole over mebendazole is that mebendazole was given twice a day for 3 days, and the dosage was 100 mg. But in cases of albendazole, the single dose is given, single dose administration is there, and that too it is 400 mg dose of albendazole is way sufficient enough for removal of the parasites. So the adverse effects of this albendazole, it is somewhat more or less similar to, okay, thank you. So it is more or less similar to the mebendazole, and some similar side effects can be seen like headache, dizziness, loss of hair. So it is similar to mebendazole, but whatever the side effects was seen in mebendazole, this adverse effects is seen to a lesser extent in case of albendazole. So whatever the side effects what we have seen in albendazole, for mebendazole, these side effects, they are still present, but to a lesser extent. So albendazole, the dosage has only single administration is required. For mebendazole, it is given twice a day for 3 days. So albendazole, it is a very convenient and a better option as compared to the mebendazole. And when we look at the uses of this albendazole, what do we find is the uses it is given for the roundworm infestations, the hookworm, the pinworm, the trichuriasis infestation, the tapeworm infestations, the strongyloidosis, strilongidosis infestations, and neurocysticercosis and hydatid disease. So these are the uses in what all conditions this anti-helmintic drug is being given. And when we look at the dosage, so this for when this albendazole is given, so if it is a pinworm infestation, this is a very important point what needs to be remembered, that if it is a pinworm infestation, the dosage needs to be repeated after 2 weeks. So single dose is to be given, but after 2 weeks another dose is to be given, just because to prevent the reinfection from ova that have matured later. So when it is a pinworm infestation is there, so there is a possibility that there are certain ova which have not matured or which are going to mature later. So for that condition, for that case, and after 2 weeks another dosage is given of albendazole in pinworm infestations. So students and viewers, this was a very short discussion where I have discussed in simple language about the anti-helmintic drugs. What are the anti-helmintic drugs? In what all conditions they are given, and what are the most two important anti-helmintic drugs? First is the mebendazole, next is the albendazole. The mechanism of action I have discussed of them, their uses, and what are the dosage and side effects. So students and viewers, if you still have any queries or comments, you are most welcome to comment me in the comment section. And viewers who are new to my channel, who haven't subscribed, if you like this video, give this video a thumbs up, and don't forget to like, subscribe and share my channel amongst your friends. Thank you for watching.